name is Robbie Omondi, and this is Life 360.
Today, we want to speak about gynecological services. And as a health communicator, not a health expert, I have a guest with me who will help us understand why do I need to see a gyna? How often do I need to see a gyna? What signs do I need to have, or do I even have to wait for any signs for me to see a gyna? Kwa mara nyingine, Vivian is with us and she will be helping us just understand the importance of going to a gyna in the first place. Vivian, karibu sana, and I don't know if you'll have to introduce yourself again, but for those who will be seeing you for the first time on this episode, sema to Gina, and then tell us, who is a gyna even in the first place?
Okay, asante sana Ruby.
Yes.
My name is Vivian Magara. I'm a nurse by profession.
Yes.
Yes, currently working in a fertility clinic. Yes, Ruby.
So tukisema gyna, who is a gyna? Gynecologist.
Okay, gynecologist. Gynecologist is a branch in medicine where that doctor specifically deals with women and girls who are on their reproductive stage. Yeah.
Okay.
Yes.
So for a woman who is in her reproductive stage of age, do they need to start seeing a gyna immediately, and why?
Okay, so to be specific, the work of the gyna is to assess, do a physical exam, tell you the functions of the women's reproductive system, and also diagnose and even treat. So it's very advisable with the changing lifestyle, the climate. It's advisable at least to be on a routine checkups to see your doctor. Not necessarily when you are ill or during illnesses, but at least to go for a checkup. There's so many diseases, so many issues recently, so it's very advisable to see a doctor. Not necessarily when you are sick, but for just a follow-up. At least it helps also in prevention. Yes.
So as a woman, let's say now I have begun my periods and I want to go and see a gyna. What questions am I supposed to ask that gyna?
Thank you. So the gynecologist mostly deal with the women's or girl reproductive system. That is the vagina, the cervix, the uterus, the ovaries, come all through to the breast. Yes. So a girl, let me put a girl who is of reproductive stage, it's advisable once in a while at least to go for a checkup, and the only place you can go for a checkup is to see a qualified gynecologist. So the gynecologist will do a physical exam for you. He will assess you. You see even girls, you see girls at 18 years, they're supposed at least to even start showing features of a teenager, the breasts. Yes, your uterus should start, at least your menses should have already started, but you find that some, they don't have them. So if you go to a doctor early enough, she will be or he will be able to check you and advise you on the way forward. Yes.
Now, say for example, I don't know my cycle. I don't know how many days it takes me to begin my menstruation or my periods. What will a gyna tell me? How will I know? How do I know basically that my periods, if I've started my periods on the 1st of September, when do they end and when should I expect my next cycle?
Okay, thank you. So regarding the menses, so that's when the idea is the menses, they come from the uterus where it sheds, then it exits. They exit through the cervix, through the vagina. Yes. For a normal, when you go to see a gynecologist, she or he will be able to explain a normal cycle, like what the normal cycle looks like. How long should you get your menses, and how long will that cycle take? So let's say you have issues. Maybe you don't have issues, but it's good to see a gyna, at least even to see the intensity of the menses you are getting. You might be bleeding a lot, which is not the case, or you might even getting slight menses, which is not good. So you can go to a gynecologist, you tell her about your menses, maybe let's say you are a girl and you just started your menses. It's good to see a doctor, gynecologist. She or he will explain what to expect. There's some cramps which are normal, there's some which are not normal. So the doctor will explain the normal things and the abnormal things, and you at least you'll be able to understand. No, this, the doctor said, if I experience this, it's not right. So you will know when is the right time to seek medication, or when is the right time to go for a doctor, now that you have an issue. Yes.
Okay, now one thing that now, since you're speaking about female reproductive health and going to see a gynecologist, many women are not aware of how to take care of their reproductive organs, if I'm to call it that way. And we find there are other products that have come in. You're told, wash your vagina a certain way. Others are telling you have to use steams, you put in some water. All these things from a gynecological perspective, is it right?
Okay, so as I said earlier, for a gynecologist, the doctor has to check all our reproductive system. Let's say we start from the vagina. I've seen even online social media, there are a lot of even herbal medication, where some you have to insert, some you have to steam, some you have to wash. They're even now, they're not even doctors, but they're explaining how you can even wash your vagina all through to the cervix. So so that's why we should really have to go to see a doctor, because right from the vagina, there's so many things, there's so many diseases you can get all through our reproductive system, which have repercussions, which have consequences. Let's say you are doing something, you might even get the infections. They build up, go up, lead even to infertility. So there is cancers, cervical cancers, uterine cancers, breast cancers. So when ideally the primary, if you're not sick, don't say that you don't need a doctor. It's good to go to the doctor. For example, there's some tests which we can do for you, at least to check if there is any issues. Let's say for the cervix, cervical cancer, which is very common among women. So a gynecologist will be able to do pap smear. There is a test we call a pap smear, which is done early. It's advisable, in fact, to do it after every 1 year to assess even if you are cervix is okay, even the health, when the doctor is looking at it, he can see even if there is any infection, or taking those cells and testing whether they are cancerous. Yes. So on up to our uterus, there is a normal uterus, then there are normal uterus. You might get someone with two uteruses, two vaginas. Yes, and if you don't go for checkups, how will you know those things? So it's really advisable to see the doctor for women who are on their reproductive age, to ascertain even your fertility levels. The gynecologist will even do a scan and see how your uterus looks, how your fallopian tubes looks, how your ovaries looks, if you have even eggs. Because honestly, as currently I'm working in an IVF clinic, where we even take donors, young girls, for donating eggs. And when you see those scans, they are young girls, maybe 20, 21, but their ovaries, their uterus looks like a 40-year-old woman.
Why?
Yes. So maybe we associate with the changing lifestyle, the trends, the medication these girls are doing, the drugs. So that's why we should always see a gynecologist, even if we are not sick. All up to the breast, we do. The doctor can be able to do a breast examinations. There's so many people with breast cancers. So even you can go to a doctor. he or she can teach you how to even examine yourself at home. Even if you feel anything, then you can seek treatment early. Because if you seek treatment early, or if the issue is identified early, then it will be easy also for the treatment.
All right. Now, I was talking to someone, I think it's a doctor, who was telling me it is possible, for example, for a gyna to even advise women, or rather there are a group of women who would be advised not to get pregnant for certain reasons.
Yes, yeah.
What would be some of those reasons, and why would a woman, for example, be advised not to get pregnant? What would lead there?
Okay. For example, well, let's say, for example, God forbid, you have been diagnosed with cancer. So there's some forms of treatment of cancers, maybe these chemotherapies, where you should start, maybe you have been advised to start a chemotherapy. That's a treatment for cancer. And during that time, you are not supposed to be having pregnancies, because now hormones come in and it makes worse. So that's when, if you go to a doctor, she or he will be able to advise you. Let's say you are at a younger age, the doctor might even advise you to go even and freeze your eggs. Yes, you freeze your eggs. Now that's keeping your eggs. Then first you go for the treatment. Once you are done with the treatment, if you want if you want to have children, now you can use the freezed eggs then to have children later. Yes. There are also some conditions which come up during pregnancies, like high blood pressure. It brings, there is a condition we call preeclampsia. Preeclampsia during pregnancies, which actually make us lose many women during childbirth. So in such a case, the doctor will be able to diagnose it early, before even you get to the pregnancy stage. Then now you might advise how to go about it, or the best treatment, then now before even going for the pregnancy.
Now, are there any other gynecological services that you feel women should embrace, and in return just take care of their reproductive health?
Yeah, sure. I can't say that we have one which is much special than the other, because it's all in our bodies. And maybe your issue, you don't have it, I have it, and it's bothering me. So there are so many diseases associated with women reproductive health. I told you, in every part: the stomach, the uterus, the ovaries, fibroids, endometriosis, adenomyosis. All those affect us as women. Infertility issues. Yes, women in careers. You can even visit a gynecologist and ask and tell the guy, no, for now I'm ready for family, or I don't have a serious partner. My age, I'm 35. I don't want to get old, and now I'll start looking for being given an egg donor to donate for me eggs. What should I do? You see, that's an advice you can get it from a gynecologist, that if you want, you can keep your eggs, go do your career thing. Then when you are ready, your eggs will be there, because they can be kept for years. Yes. Or if you are a couple and you have been having unprotected intercourse for a year and you are not conceiving, honestly, you should even go and see a gynecologist, because we'll start from the gynecologist before even you reach to a fertility specialist. So the gynecologist, she's the one, or he's the one, who will be able to do the initial test, and even determine your issue. Then coming to the tubes, women, you even don't know, because those are some diseases which don't even show signs. So you are trying even for pregnancy, but you don't know that the issue is in the tubes. But the gynecologist, from the test which she prescribe, she'll even give you tests like hormonal tests. You'll be sent for HSG. They want to see the tubes, if they're blocked or open. So mostly gynecologists help with initial assessment and diagnosis. To help for early treatments.
All right. Now, how often then should I go for gynecological tests? Do I need to wait every month, 2 years, 1 year, 3 months? What is the period that a woman needs to wait before going for the routine checkup?
Okay, now it depends. Like say if you are just concerned with maybe your health, your serology test, this like HIV, hepatitis, like those tests, someone can, a gynecologist can advise you to at least repeat them every 6 months. Yes, yes. Fertility checkups, a doctor might request for you to do like every year at least to check your hormones, and the quality and quantity of your how your ovarian reserve. Yes, yeah. And also for like the cancers, those are some of the things, like the breast cancer. So those are the things you can even get guidance from the hospital, and you can be doing yourself at home. The pap smear, this is advisable to do it yearly. So it depends on what you are really looking for,
and the concerns. Also, just basically, as women listening to your body, I think when you have changes in your body as a woman, you'll notice there's something that is not right in your body.
Sure.
And the moment we realize that, I think it's important that we just visit a gyna and understand what is going on. Once upon a time, Faith was telling me about girls who have early periods, or rather young girls who receive their periods early. Are there disadvantages of having early periods for young girls, especially because now we have young girls as young as 9 already having their periods? What does that mean?
Okay, so women, we are different. Yes, we are different. Whatever you might experience, I might not experience. Yes. So it depends, but it's it's not like it's a bad thing to start your menses early, because times are changing, the climates, the lifestyle, and everything, and whatever you use. So the only issue which has been associated with the early menses, it's issues with the endometriosis. Endometriosis, it's where you get that the uterine lining, it's in other places which is not supposed, where it's not supposed to be. So they say that when you get your menses early, so every time getting menses, getting menses, those tissues might move to other places. So which causes painful menstruation. So if you are there and you are having you every month you get your menses, there is a lot of pain, a lot of cramming. No, don't say that that's the nature of women. You should seek help. You should go to see a gynecologist. She or he will be able to identify where the pain is coming from. There's some cramming, there's some being like discomfort, but it should not be that extreme where you even have to miss work. Some even get they don't even get jobs, because every month you have like 4 days you are just lying at home or in the hospital. So you should seek medical advice.
All right, maybe I'll parting shot for anything that we need to know about gynecological services, about our reproductive health as women.
Okay, so as for women, we should really take care of ourselves. We should seek advice. Let's not
assume.
Let's not assume, and let's not listen from the misunderstandings which are out here, online things. Don't just see anything online and you want just to insert it in your vagina, the cleaning and whatever. At least seek medical advice. You can even consult a doctor if you can use a certain things. These over-the-counter medications, they are really messing. You just see anything online, you have gone to the chemist, you bought it and you start taking. It's good to even see the side effects and the adverse effects of whatever you take. Let's take care of ourselves. A balanced diet, take a lot of water, maintain a healthy diet, exercise regularly.
All right, thank you very much, Vivian. And for me, I think basically one thing that I've learned, like while talking to gynas and doctors like you and nurses, it's that just listen to your body as a woman. When you realize that when you're peeing, you're feeling painful. When on your period, there's some pain that is not normal. There's pain. Most women have discomfort when they're having their period. When it gets to a painful place where you can't walk, you can't eat properly, you're having, different other symptoms while on your period, it's just important to seek advice and to go and see a gyna. So I believe that we can learn from what we're talking about. Just go to a gyna as much as you can. so long as you're able to, and when you feel discomfort or just when you want to make sure that your body is operating normally, especially when we talk about our reproductive health. Thank you very much, Vivian. And to you, my viewer, thank you for tuning in up to this end. And now allow us to end it here. Let's all take care of our bodies. Our reproductive health means a lot because, again, if it's not well taken care of, then it means our health in general is also compromised. Until next time, adios.